And why that's important is because at some point, the counsel for the mentally impaired, the mentally disabled, the intellectually impaired, the intellectually disabled is going to have to make a decision as to whether that is evidence that will be beneficial to the claims and defenses and needs to be used, or it's evidence that's going to be detrimental and it needs to be kept out, and the discovery of that information needs to be protected in order to not make the client's situation worse or to worsen the available claims and or defenses to that client in that particular case. So how do we determine the mental health of our clients? And again, these are invisible injuries. Somebody may come into your office and present very adequately. They may be dressed professionally. They generally may have by outward appearance a persona of professionalism, put together, clean cut, and sometimes not. Sometimes it's much more obvious because somebody will have these defects and they'll manifest themselves in the way that they cannot conform their behavior with society norms. They are not wearing clean or nice, sharp clothes. Their presentation, their presentment, the way they project themselves out into society is poor, and they may have outbursts. So this can range from the very hard to the very simple. And it really just depends on how badly these symptoms are manifesting and how much damage the client may or may not be doing to themselves by self-medicating with drugs and alcohol or both. And those are things that, as counsel, need to be investigated. In addition to that, a good lengthy interview with the client is always beneficial. And sometimes that interview needs to spill over into the client's family so you can get an accurate picture of what their mental health situation is like and how it's transpired over the weeks and months and years leading up to whatever this incident is that has them either in a criminal proceeding or some sort of civil proceeding where their mental health is at issue. It's that investigation that needs to be thorough, and it's easier said than done because not every client has unlimited resources. Can't ask them for a medical release, a HIPAA release, and then just go out to all the mental health places that they have ever treated at, because most of them have not treated anywhere except with drugs and alcohol. Or if they have treated somewhere or been institutionalized somewhere, they may have a fuzzy recollection of it. It may be years in the past. They just not know. And that makes it very difficult to pin down and determine the scope of the mental illness and how it may or may not help you with the claims and defenses that are available to that client in their particular case.